And everyone, refresh your pages. We are off and running. Hi, everyone. My name is Emily, and I'm the community manager here at 2 Diabetes, working with Diabetes Hands Foundation. And today's interview is the next piece in our Type 2 Diabetes series that we're doing for the months of October and November, focusing on services for people with Type 2, issues that affect people with Type 2 diabetes, things that are of particular interest to those with Type 2 diabetes. But of course, a lot of the time, those things are also of interest to people with other types of diabetes, and this series is really open and welcome for everyone. Today we're talking with Ansley Dalbo. Welcome, Ansley.
Thank you, Emily. It is such a pleasure to be here. I'm such a huge fan of the Diabetes Hands Foundation, and I love that you guys are focusing on Type 2, so thank you for having me.
Thank you so much for taking some time to do this today. Let's start off. So Ansley is the founder of a brand new platform called Diabetes What to Know. And Ansley, let's start off with who are you and what brought you to this platform?
Sure. So about 13 years ago, I started working with Walmart on their private label diabetes brand, which is called Rely On. And I really had not been exposed to diabetes before that, but in working on the brand, I worked with a lot of diabetes companies, and I got to interact with a lot of diabetes patients. And I just became such a huge, huge fan of people with diabetes and all that they take on. It's amazing.
And love to have fans.
Well, I am one. You know, I just met so many people who use the diagnosis of diabetes as a kind of a wake-up call, and this is Type 2 diabetes, as a wake-up call to be healthier. And they didn't sit and feel sorry for themselves, as I might be tempted to do. They just dove in with 2 feet and really used it as a way to kind of become evangelists for, you know, trying to eat better and exercise and take medication. And, you know, about 2 years ago, my husband and I decided that we wanted to create an educational resource for people with Type 2. And we wanted to try to use videos as a way to kind of take education into the 21st century. I don't really do a lot of, you know, reading of pamphlets anymore. I want to watch videos on YouTube and kind of learn what I need to know. So that was kind of our beginning, and we talked to so many people with Type 2 and just learned so much from them. And the more we got into it, the more we just felt like we need to help these folks share their wisdom with everyone who has Type 2 diabetes. And so that's really our goal. And we're so excited about it. We've been around for 3 months, and it's just been an amazing journey so far. We're learning so much and just been really having fun.
That is awesome. I absolutely love this attitude that you have of admiration for people who have Type 2 diabetes. You know, last week as part of this series, we talked about blame and shame for people who have diabetes, and particularly for people with Type 2, and sort of how people are seen in our overall society. And that a lot of times right now people are kind of blamed for having diabetes, or they're really shamed about it. And I love that your approach when you learned more about diabetes and met a lot of people who had it was admiration for what they do, what we do, and how we manage our health, and that you felt like people with diabetes really have a wisdom to share. I think that is absolutely beautiful.
You
know,
so yeah,
go ahead.
I so do have that. And I think, you know, everyone has obstacles in their life, and, you know, some people's genetic predisposition is going to mean that diabetes is kind of the obstacle that you're trying to deal with. And what I've been so amazed by, you know, my husband and I did a whole day of interviews with people with Type 2 here in Atlanta. And when we got in the car at the end of the day, we just felt so blessed that there were so many people that we talked to who just want to give back. You know, they feel like, okay, I've been through this, I've learned some things, I really want to help other people. You know, and it's amazing how people, when confronted with something, their instinct is, I want to help other people. And that's just been so my experience for people with Type 2. And, you know, when you talk about shame and blame, the first day of our email course is, this is not your fault. Because I think what happens across a whole bunch of things is something bad happens and our first instinct is to blame ourselves. And that is just, it's not true. And it really sometimes keeps us from acting on our own behalf and kind of taking that next step towards, okay, this is real, what am I gonna do next? Shame is just kind of a hole that you can fall into and never get out of. So I love that that was your topic last week, because I think that is so important to kind of, that's really the first thing you kind of have to take on, is deciding like, this isn't, you know, this isn't my fault and I'm not gonna let that get me down, and I'm not gonna believe people who might feel that way.
Absolutely, absolutely, I love it. So you said that is one of your first pieces. So tell us more about how Diabetes What to Know works. Like, what do you do on there? If I go to the website, what do we find?
Okay, so one of our insights when I was, you know, talking to people with diabetes was, they just said, you know, I've just been diagnosed and I want to learn, but I'm just overwhelmed. You know, there's just so much information and I don't know where to start. And so it just seems like, okay, well, there's an opportunity here that we can, through email, you know, give people a little bit of information each week. So kind of make it bite-sized and manageable, and most of all, action-oriented. So rather than talking about glucagon and insulin and a whole bunch of confusing things that are still confusing to me after 13 years of working in diabetes, let's just like break it down to the basics, and let's just do it a little bit at a time. So rather than having to kind of hunt around on our website for information, what we suggest is that you sign up for our email program, and you'll get a couple of emails each week for 6 weeks. And we'll talk about how to use a meter, how to use your meter to test in pairs, so you can start learning what certain things do to affect your blood sugar. We'll talk about how to read a food label. We'll talk about managing blood pressure, just kind of the basic stuff. They're short 4-minute videos. You know, you can watch them a couple times if you want to kind of go over and make sure you get everything. And we give you little action items, like little small things to do at the end of the video. They're nothing like running a marathon. It's more things like, you know, see if you can get up and, you know, do a little extra activity for 10 minutes this week, and see, you know, maybe test in pairs before and after and see how you feel. So we're really focused on, you know, just breaking it down to bite-sized amounts of information and giving it to you a little bit at a time. And so far, the feedback that we've gotten from folks has been really positive. So we're continuing to hone and make things better. But so far, I think we're kind of on the right track.
Nice. I watched the videos, and I really, really liked them. The ones I saw were videos of you speaking, Ansley, and the folks who are watching can probably tell Ansley has a really wonderful, lively, positive demeanor, and I loved the way that you presented the information, so that there wasn't any kind of condescension. Of course, it was just really positive, like, here's something really that might be really useful to you that you may or may not know yet. Are all the videos of you speaking? Do you have a variety of speakers? How's that piece work?
So that's a great question, and I'm so glad to get to talk about that. It certainly was not our intention to have me do all the videos, but we are on a very limited budget, and we kind of have to shoot in different places where sometimes noise is a big problem. So our shoots can take a lot longer than a normal person would be willing to tolerate. So we kind of defaulted to me as the narrator, just because I'm the only person who would say, okay, we're gonna have to wait for 2 hours while the leaf blower outside stops blowing. So, I mean, my husband and I, he runs the camera and does the sound and, you know, does the makeup, and I, you know, just wait and, you know, read the teleprompter and do the best I can. So, you know, certainly we will definitely hope to have more, you know, professional narrators over time. But we do have, you know, people with diabetes introduce each video and talk about why the topic is important to them, and, you know, what they think people should know about reading a food label, for example. And all of our interviews with people with diabetes are actual people who have type 2 diabetes, talking about what they've learned, what they would tell a newly diagnosed person, what positive things happen because of diabetes in their life, you know, what bugs them, what they are frustrated about. You know, we really want to hear kind of about the whole spectrum of their experience, because I think, back to the whole blame and shame thing, I think that hearing from other people with type 2 might make a newly diagnosed person not feel so alone. You know, you look at people and you say, well, you know, they've got it together, they're figuring it out, you know, I can too. And that's really our goal over the long term.
Nice. So how did you come up with the variety of topics that you've covered so far? What are they? And do you have a list of topics yet to come?
Well, that's such a great question. So I have worked with Will Dubois, who is an amazing healthcare treatment specialist, and he writes for Amy Tenderick's blog, Diabetes Mind. He writes for D-Life. He's just an amazing person. He happens to have type 1 diabetes, but he also works with a lot of type 2 people in a nonprofit clinic in Pecos, New Mexico. So I think he is probably the smartest person in the world, especially about the topic of diabetes. He knows so much. So he is really the person who has, written all of our scripts, who's kind of come up with a lot of the ideas, and he's got such a unique approach. I mean, he really is the one who said, it needs to be short, it needs to be really focused on what someone can do. Really, he has been so instrumental in helping us figure out, okay, these are the topics that we want to cover. So right now we talk about, and I'm going to repeat myself a little bit, how to use a meter, how to test in pairs, which Will has really helped me realize how important that is. That, testing your blood sugar one time, one number doesn't really tell you a lot. But if you test before and after something, like before a meal and then 2 hours after the first bite of a meal, it can really give you a lot of information about how that meal affects your blood sugar. So those are two topics. We talk about what can I eat, which kind of covers, basically what we call the white foods rule, which just says you can eat a whole lot. You don't have to never have your favorite foods again, but try to eat one white food in each meal. So don't have a potato and a roll in the same meal. And I have to say, I've had all my family members watch the videos to kind of tell us what they think about it. And my aunt was like, Ansley, you've ruined me with that white foods roll. She's like, now when I look at my plate and I see a potato and a roll, I just say, I can't have one of these. And I'm like, Kathy, that's great. That's a healthy way to live.
That's a good change.
Diabetes or not. So that's a few of our topics. And then we talk about exercise and we talk about blood pressure. And then really probably my favorite video is where we talk about depression and stress, because a lot of people don't talk about it, but people with diabetes are twice as likely to be depressed as people without diabetes. And when you're depressed, it really becomes hard to kind of manage your diabetes. So we really wanted to raise awareness of that and talk about, depression is a disease, and if you're feeling depressed, it's not something to feel ashamed about. It's something that you really should go get help for. And I'm certainly not a mental health expert, but Will felt strongly, and I completely agree, that that's something that should be talked about more than it is. So we talk about depression and managing stress and how stress can raise your blood sugar, and managing stress is really an important part of diabetes. So those are our videos as they are now, but we have so many exciting ones planned. And everyone, if you have ideas for videos, I would love to hear them. Send me an email. It's ansley@diabeteswhattoknow.com. And I would love any suggestions on here's what I think you should cover, or here's a question I have that I'd like to get more information about. We really want to hear from you. So here's what we have so far. We're going to talk about what is an A1C, why foot care is important, another topic that's not talked about a lot but is really important. Let's see, now I'm going to have to remember. Alcohol and diabetes. So if I have diabetes, how much can I drink? How much should I drink? We're going to talk about, I'm probably going to keep, the plate method, because a lot of people talk about, looking at a plate and trying to decide what to eat. And then last but not least, hypoglycemia. What people with type 2 should know about hypoglycemia, what medications put you at risk for hypoglycemia, how to treat hypoglycemia, just kind of the basics. So that's what we have planned so far. But Emily, do you have any ideas for us? What are we missing?
I do. When you were talking about, now I forget what you were talking about. That made me think of this, that one of the things that can really increase, you were talking about how stress can raise blood sugar, right? Because it can increase, insensitivity to insulin, also known as decreased insulin sensitivity. And another thing that can do that is lack of sleep. And a lot of people don't know that. I think that there are a whole lot of things that can make us more insulin resistant, both people with type 1 and people with type 2, and people with other types as well, I think. And so I think maybe a whole session on things that can make your blood sugar go up because they make you insulin resistant could be really useful. It could even be done in kind of a list form. But personally, I am very insulin resistant a day after a bad night's sleep. And I've had enough people know about that.
That is so, I see, and again, I'm learning. I mean, I think insulin resistance is a topic that it can just be very confusing. And I think one of the things that someone told me a long time ago that just blew my mind was how exercise really makes your body more sensitive to insulin. That's one of the many, many, many benefits of exercise is that increased insulin sensitivity. So I think you're totally on track there. I think a topic about insulin resistance and sleep is the magic bullet for everything, I think.
It sure is. It sure is. You know, and speaking of exercise, I think for a lot of people are told like, oh, if you go exercise, it will definitely right now lower your blood sugar. But different kinds of exercise do different things to blood sugar. So there's another really interesting potential topic.
No,
whether it's cardiovascular or if it's weight training, different exercises do different things. Excuse me. We have another suggestion in the chat room on 2 Diabetes right now, which is holiday eating. Oh boy, is that a good one.
A lot. That is a great suggestion. I think holidays ought to be like maybe a series of videos dealing with the stress of holidays.
Absolutely.
You could come up with
your family. Sometimes dealing with family on holidays, you know, for some folks, holidays are kind of the only time that they actually spend with their family. And then it tends to be time that's spent around a dinner table, having some kind of decadent feast. And for folks who have diabetes, like that decadent feast can go really differently than it does for other family members. And it can be either a time to educate them about diabetes or potentially to get upset because sometimes people have misinformation. Sometimes we have the diabetes police in our families and people saying like, hey, I know you shouldn't be eating a piece of pumpkin pie and all that kind of stuff. The holidays are just so rich with opportunity.
Well, you know, actually, I forgot one of our main topics, and one of the things that Will just is so funny about and so passionate about is family. You know, one of our diabetes educators says, you know, family members can be either the best or the worst medicine for people with diabetes. And that is so true. So, you know, I think family members want to know, what can I do to be supportive? I think, you know, there's so many good intentions, but, you know, it's hard not to be the diabetes police. So a video series about family members and what they can do to be helpful. And, you know, for people with diabetes, like, what should you communicate to your family members? You know, how can you help them be constructive and supportive? That's definitely a topic that we want to take on because I think it is so important to kind of just the reality of day-to-day life.
Mm-hmm.
Sure.
We have another suggestion in the chat room right now for a talk on kidney issues and what to do about them. Kidney care.
That is a great suggestion because we would definitely want to take on all the complications, hence foot care, and kidney issues is definitely something that probably doesn't get as much attention as it should. So
yeah.
Oh, yeah. Since we have your folks on, I'd love to hear their thoughts on this. A physician yesterday actually suggested that we do a video about kind of how to get the most out of a doctor's appointment. How to advocate on your own behalf, and also, you know, what should you be trying to talk to your physician about or your educator about in that short window of time. And I thought that was a great suggestion, but I would love to hear, you know, if people think that would be something they'd be interested in watching.
So, folks in the chat room, write in and let us know if you would be interested in a topic on diabetes, what to know about how to make the most of a visit with your care team. I know that it's something that I've actually done a live interview a couple of years ago, I think, with an endocrinologist who came on to talk about precisely that, and people were really interested. I think, you know, we talk about how little time we get with endocrinologists, certified diabetes educators, nutritionists, with any of these folks who can help us to manage our diabetes. We have this tiny little sliver of time with them usually, but of course we are managing our diabetes 24/7, 365. So the comparison between time managing and time talking to the folks who can help us with that is really skewed. is really skewed. And this actually leads us to a comment in the chat room a little bit ago by David, who was saying, you know, a lot of people don't have a whole lot of access to medical providers. Some people live in small towns that don't even have an endocrinologist or a certified diabetes educator locally. And so David was wondering if Diabetes What to Know is in part an effort to try and bring that necessary information to people who don't have access to folks in person.
David, you are right on with that. So I'm from Atlanta, Georgia originally, and my husband is actually from a small town in South Georgia called Jessup. And his sister still lives there, so we go there fairly often. And one of the things I've really been struck with is there's no endocrinologist in that community. There's no diabetes educators there. There's no support groups. And there are a lot of people with type 2 diabetes in that community. So we are really trying to fill a gap. Unfortunately, there just aren't enough diabetes educators. There aren't enough endocrinologists. So we're trying to get the basic information available on the web. And for people who do have access to an educator, we want to give you the basics so that you can go to your educator and have a really great appointment. So if you already know how to use a meter, you can really focus with your educator about your meal plan or things that you've noticed, you know, with your blood sugar, because knowledge is power, and the more knowledge you have, the more productive you can make that time with your medical professional, whoever it happens to be. So David, you're right on. You're right right in line with what we're trying to accomplish.
David is frequently right on. Well done, David. So right now, so you have this series of videos, right? And somebody can sign up and get, is it a video every week that they watch? Do they sign up for a specific series of videos?
They sign up for what we call our 6-week program. So they will get a video each week. And then as we add additional videos, they'll get an email and, you know, notify them that, you know, this is our topic for the week. But speaking of more videos, in November for Diabetes Month, we are driving across the country and doing interviews with people with type 2 diabetes. And so if you live in Houston or El Paso or Santa Fe or the Bay Area, I want to hear from you. Send me an email, Ansley@diabeteswhattoknow.com, because I want to interview you and hear your story, and I want you to be able to share your wisdom with other newly diagnosed folks. It'll only take about an hour, and I can email you. If you email me, I'll send you all the specifics, but we would love to talk to anyone kind of on that route. So please do send me an email. So we're hoping to add, we're doing interviews with both people with diabetes and also healthcare professionals. So for all those people who don't maybe have a diabetes educator in their community, you can come on our website and hear interviews of what an educator would want to tell you if she or he did get to spend some time with you. So that's kind of our goal, and we're hoping to add about 20 interviews from that trip in November. I know we're going to be very busy.
Yes. So where do people access those interviews then? Do they have to go to the website, or will they get emails about those?
They will get emails about those if they've signed up for the email program, but if they haven't, they can just go to our website, and on our homepage, there's a tab that says videos, and you can click there and you can see I think we have 18 videos up right now, and we are just going to keep adding to those over time. You know, just as we do different things. We recently went to Stockholm for a diabetes conference, and we did a couple short live videos from there, which was crazy, but a lot of fun, and we learned a lot. And so we're just, you know, trying to bring news to people with type 2 as we learn it, things that we think would be helpful to them.
That's fantastic. We have a comment in the chat room right now, getting back to making optimal use of a doctor's appointment. Mike Lawson in the chat room is saying that he likes to go in with a list of questions or topics that he knows he's going to need to cover in that doctor's appointment. That's brilliant. And I think it really is a topic that could be covered in a video, because there can be a lot of information to try to get out, as you said, to try to get out of that appointment, and very little time in which to do it.
You definitely need to be prepared. You know, it's something, you know, the time can get away so quickly, and I think a list of questions is a great way to do that. I think that's an excellent suggestion. And one, Mike, that we'll probably steal for the video. I hope that's okay.
Mike is my colleague, and he's sitting in this room right with me, and he's nodding his head that that's okay.
Excellent.
Awesome. Well, Ansley, we don't have any more questions in the chat room right now, so I want to encourage folks to go check out Diabetes What to Know. The videos really are very well made, and the information is fantastic. Share the site with friends that you have if you know folks who are newly diagnosed, especially, and just sort of beginning to learn the basics. But even the stuff about diabetes and emotions and blame and shame and things like that are useful for folks who've had diabetes for a long time. So, Ansley, thank you so much for your time today and for your great work.
Emily, thank you so much for this opportunity. I'm, again, huge fan of all that you guys do at Diabetes Hands Foundation. Thank you.
Likewise.